Hello viewers, welcome to my today's discussion about basics of anesthesia. This class is mainly prepared for the undergraduate graduate students. But first we can define and classify the anesthesia. What is anesthesia? If we say that loss of sensation, this is called anesthesia. And if we differentiate from local anesthesia to general anesthesia, then we can say that anesthesia means loss of sensation with or without loss of consciousness. And there is three main classification of anesthesia. One is general anesthesia, another is regional anesthesia. Regional anesthesia is further classified in this central and peripheral anesthesia. Example of central anesthesia: subarachnoid block, epidural block, coronary block, etc. And example of peripheral anesthesia is brachial plexus block, popliteal block, wrist block, and many others block, regional anesthesia. And another classification is local anesthesia. What is general anesthesia? Reversible loss of consciousness, loss of pain, amnesia, and some degree of muscle relaxation, which is suitable for operation. This is the general anesthesia. The goal of general anesthesia is to maintain the amnesia or hypnosis of the patient and loss of pain and muscle relaxation for suitable operation environment. What are the steps of general anesthesia? You can say that induction, then with intubation, then maintenance and reversal, recovery of emergency. What is the triad of anesthesia? We can also say that it is the triad of general anesthesia. Any kind of general anesthesia, the target is amnesia, analgesia, and muscle relaxation. These three combination is called triad of anesthesia. These three elements work together to allow the safe and effective surgical procedure. What are the drugs used for general anesthesia? To assist the triad of general anesthesia, amnesia or hypnosis is done by intravenous, may be done by intravenous drugs or inhalational drugs. Intravenous drugs, we usually use thiamine, sodium chloride, ketamine, hydrochloride, and many other drugs, intermediate, etc. Inhalational drugs, which is used for amnesia or hypnosis, nitrous oxide, diazepam, antifuran, sulfuran, etc. Analgesia is maintained by opioid analgesics or non-opioid analgesia, and also local anesthetic drugs maintain the analgesia. And muscle relaxation, there are two kinds of muscle relaxation. That is depolarizing muscle relaxation and non-depolarizing muscle relaxation. Depolarizing muscle relaxation relaxant is example is succinylcholine. Is also short-acting muscle relaxant. Non-depolarizing muscle relaxant example is bacterodium bromide, rocuronium atractorium, cisatractorium, etc. And it is further classified into according to duration of action: short-acting muscle relaxant, intermediate-acting muscle relaxant, and long-acting muscle. Short-acting muscle relaxant, we can say that docurinium is the short-acting muscle relaxant. Intermediate-acting muscle relaxant, docurinium, bromide, and tibecurinium, which is the long-acting muscle relaxant. What is regional anesthesia? When the part of the body is anesthetized by local anesthetic drug injecting into the nerve root or nearer to the nerve. This is called a regional anesthesia. Regional anesthesia is done by local anesthetic drugs also, such as bupivacaine, lidocaine. Now, if we say that examples of regional anesthesia, the brachial plexus block, wrist block, popliteal block, and many other blocks. What is local anesthesia? When local anesthetic drugs is applied locally to loss of sensation of that area and perform the operation, that is called local anesthesia. What is the main difference between local anesthesia and regional anesthesia? In both of cases, local anesthetic drug is used, but in local anesthesia, no need to inject the drug in the nerve root or nearer to the nerve. In any other site, in intramuscular muscle local anesthetic drug is applied. And in case of regional anesthesia, the local anesthetic drug is applied to the nerve root or nearer to the nerve. This is the main difference between local anesthesia and regional anesthesia. Local anesthetic drugs. What are the examples of local anesthetic drugs? Lidocaine, bupivacaine, or a combination of the lidocaine, bupivacaine, etc. Local anesthesia, there are so many formulations of local anesthetic drugs: injection, creams, gel, sprays, ointment. That's